Hello viewers, today we will talk about MBBS ENT practical exams, and more specifically we will talk about the new regulations introduced by National Medical Commission. Anything new, understandably, can be a source of anxiety and confusion. When I was an MBBS student, practical exams meant negotiating long case, short case, instrument, radiology and grand viva. Today, medical students have to negotiate all of these, and in addition to this, they have to negotiate OSCE, OSPE, and AETCOM. Why were these new regulations introduced? Perhaps National Medical Commission felt that medical students in India required more guidance in terms of how to communicate with patients, so that they could become more competent doctors when they finished their MBBS curriculum. Now, this can be a source of nervousness for medical students. However, I feel that this can also present a great opportunity to them, because OSCE, OSPE and AETCOM should ideally be assessed objectively, and objective assessment means if students answer the questions correctly, they stand to get 100% marks in these stations. If you're new to this channel, hi, I am Puspen Dasgupta, an ENT specialist from India, and I upload videos on YouTube at 9 p.m. Indian Standard Time every day of the week. Tuesday is for MBBS ENT, and today I will discuss how to ace OSCE, OSPE and AETCOM parts of the practical exams. Stay tuned. Why should you listen to me? I have worked as an assistant professor in a National Medical Commission recognized medical college, and I'm also a member of the Royal College of Surgeons of England. In order to become a member of the Royal College of Surgeons of England, I had to pass an OSCE format exam. So maybe you'll benefit from my advice. Let's start with OSPE first. P means practical, or in this case, picture. So in OSPE format, you'll be asked to label pictures correctly. Which pictures? Usually pictures will be taken from the most popular ENT textbook in India. So if you have gone through the pictures in your textbook and have carefully noticed the labeling, then you should not have any trouble labeling the images in your OSPE part of the practical test. Let's look at an example. Look at this picture. Did you notice the labeling properly? In the OSPE format, the labeling can be removed digitally or modified, and you might be asked to correctly label the parts labeled A, B, C, D and E. If you get all 5 correct, then you get 5 out of 5. There is no room for examiner bias here. So that's why OSPE is beneficial to you. Same way, OSCE and AETCOM are also beneficial to you. Don't worry, let's move on to AETCOM and OSCE. OSPE essentially tests your knowledge, more specifically your knowledge of anatomy. However, OSCE and AETCOM test other skills apart from knowledge. OSCE, C for clinical test, tests your ability to perform a clinical test properly, whereas AETCOM, attitude, ethics and communication, tests your ability to communicate effectively with a patient. Having said that, knowledge is also tested in OSCE and AETCOM stations. How is knowledge tested in OSCE? For instance, if your OSCE task is to perform absolute bone conduction test and you don't know how to perform absolute bone conduction test correctly, then you lose out on the bulk of marks in your OSCE station. Similarly, if your task in AETCOM station is obtain informed consent for septoplasty and you are not aware of the details of septoplasty, you are not aware of the complications associated with septoplasty, then how can you communicate effectively with a patient about septoplasty? So if you encounter an unfamiliar task, are you likely to get 0? No. Every OSCE station, every AETCOM station has a template, has an approach. How do you approach AETCOM station? How do you approach OSCE station? That is what we will discuss here. My advice to you, if you encounter an unfamiliar task in OSCE or an unfamiliar task in AETCOM, is please don't be silent. Perform the tasks that are common for every AETCOM station and every OSCE station. You will get some marks. Now let's discuss AETCOM and OSCE in further detail. If you want to learn about how to approach AETCOM stations, you can watch my Practice with Puspen playlist. It has various topics and you might benefit from watching those videos. AETCOM stands for Attitude, Ethics and Communication. In every AETCOM station, start by introducing yourself. Mention your name, mention your designation. You can introduce yourself as a medical student. You can also introduce yourself as an ENT doctor. Both are acceptable in the exam. Then you should confirm the identity of the patient. Sometimes you'll be communicating with the patient, sometimes you'll be communicating with the parent of the patient. In simple words, without using any medical jargon, explain the disease to the patient, explain the complications of the disease, and explain the various management options. Always check for understanding. At the end of the entire discussion, summarize the entire discussion. Before completion of the stipulated time, don't forget to thank the patient. Time management is of paramount importance. A timekeeper might be monitoring the time and an examiner might be observing your entire communication with the patient. Each step might carry marks, so be very careful. It is very important that your communication with the patient is not in the same language or uses similar words as your communication with the examiner. What do I mean by this? Suppose a patient asks you, "Doctor, what is meant by cholesteatoma?" You can say something like, "Cholesteatoma is a severe ear infection which is associated with destruction of bones in and around the ear." You can even say this in the local language that the patient understands. Please don't speak in a language that the patient doesn't understand. Even if you use simple words in English and the patient does not understand English, that communication is futile. So please understand which language the patient is comfortable with and you have to communicate in that language. Coming back to the original point, if the patient asks you what is cholesteatoma, you can say it is a severe infection of the ear which can destroy bones in and around the ear. However, if an examiner asks you what is cholesteatoma, you have to come up with a better answer. For example, if the examiner asks you what is cholesteatoma, you can say something like, "Cholesteatoma is a three-dimensional epidermal and connective tissue structure, usually in the form of a sac, which conforms to the various spaces in the middle ear, attic and mastoid, has property of independent and progressive growth, often at the expense of the underlying bone, and also has a tendency of recurrence after removal." Do you get my point? The communication with the patient has to be different from the communication with the examiner. Communication with the patient will be in a language that even people who have never read medical textbooks can understand, whereas communication with the examiner should preferably use as much textbook language as is humanly possible. Again, you can watch my Practice with Puspen videos and you might get an idea regarding how to communicate with patients and how to communicate with examiners. Let's move on to OSCE. Let's talk about OSCE now. C for communication, C also for clinical test. So OSCE assesses both your communication skills and your ability to perform a clinical test. It also assesses your knowledge, as I have previously illustrated with an example. In OSCE stations, you should start just like AETCOM by introducing yourself. Mention your name, mention your designation. Then confirm the identity of the patient. Figure out which language the patient understands. This is of paramount importance. Don't start talking in English if the patient doesn't understand English. So figure out the language the patient understands, then use simple words to describe the test you're about to perform. Once you have described the test in simple language, obtain verbal consent to perform the test. Again, if your task is perform absolute bone conduction test, don't tell the patient, "I am going to perform absolute bone conduction test." That means nothing to the patient. The patient understood absolutely nothing. Even if the patient gives consent for performing absolute bone conduction test, that consent is not valid because you did not explain to the patient what absolute bone conduction test is. Don't assume that the patient will know what absolute bone conduction test is. Please explain in simple language what absolute bone conduction test is. For example, tell the patient, showing him the device you will use, which is a vibrating tuning fork. Tell him that this is the tuning fork. I will make it vibrate and I will place it on the bone behind your ear. do you have any pain on the bone behind your ear on either side? The patient will say no. Then you will say, I will start by examining your normal ear first. Which ear do you have a hearing problem in? The patient might say, I don't have any hearing problem in either ear. Then you can start with any one ear of your choice. But it is of paramount importance that if the question does not mention any particular ear, you have to examine both ears. Please don't make this mistake. I have seen too many students make this mistake. If the task says perform absolute bone conduction test, you have to perform it on both ears. So tell the patient, I am going to place this tuning fork on the bone behind your ear. When you stop hearing the sound, please raise your hand. Then you have to place the tuning fork on your own bone behind your ear and compare the duration of the sound. If you can still perceive the sound, then you will interpret absolute bone conduction test as reduced. If it is not perceptible when you place it on your mastoid bone, then you write absolute bone conduction test not reduced. Okay. However, when you are interpreting the test, you will use these terms like not reduced or reduced. But when you are telling the patient what you found out with this test, don't say absolute bone conduction test not reduced. That doesn't mean anything to the patient. You can say something like, if absolute bone conduction test is not reduced, you can say something like, most likely your hearing in the ear I examined is normal. Now, most likely is very important because no single tuning fork test can conclusively prove that the hearing in any ear is normal. So if you are doing Weber's test and it is not getting lateralized, don't tell the patient your hearing is normal. You can say your hearing is probably normal. However, we need to conduct a few more tests to be absolutely certain. That's how you approach this. Is it clear? So interpret the test using appropriate textbook language and also explain what that interpretation means to the patient. So you can say Rini is positive to the examiner, that I found Rini to be positive in right ear, but you should also explain to the patient that this can mean that your hearing in the right ear is normal, or you may have some sort of a problem with the nerve responsible for hearing, or the inner part of your ear which is responsible for hearing. Am I making sense? Now let's talk about the appropriate terminology to describe some of the common clinical tests in ENT. Let's start with Dix-Hallpike's maneuver. It is either positive or negative. Let's talk about spontaneous nystagmus. Either it is present or it is absent. Let's talk about anterior rhinoscopy. Either no abnormality detected or you have to describe the abnormality that you have detected. Rini's test, it is either positive or negative. Weber's test is either lateralized to one ear, either left or right, or Weber's test is not lateralized. Absolute bone conduction test either is same as the examiner or reduced. Okay, so I have covered some of the common clinical tests in ENT, and it is of paramount importance that you go through all the common clinical tests, how to perform them, and you will be fine in OSCE. I expect you to get 100%. Don't worry too much. If you have any doubts, please feel free to mention it in the comment section below. Now let me describe how to perform a clinical test with the help of a video. In this video, I will be demonstrating the correct technique of checking for spontaneous nystagmus in a patient. I will only be demonstrating the technique, not the communication part, so I hope you will like this video. Thank you for watching this video. Take care. I hope to see you soon in the next video that I upload. Thank you so much for watching my other videos. Thank you for subscribing to my channel. It means a lot to me. Take care. All the best for your exams. I know you will do really, really well. And please, don't forget to be awesome.